some of my patients keep asking different goal. I know. So when you go to Google and go I know, this here is a basically go up I know or the full range of I know is between 2 and 3 most indication, except for the mechanical mitral valve replacement or mechanical heart valve and 0.5 to 2.5. That's correct, but was the other special INR is 2.5 to 2.5, and not only way the mechanical but well. Sometimes if people who have uh, um, different thrombosis or DVT or the AFib that cannot be controlled by warfarin with the go-to B. For example, people have been taking warfarin with the iron rampage 2 and 3, but still have stroke or still have recurrent DVT or PD. They may increase the iron range to 2.5 to 3.5. Make sure they're not having stroke or the recurrent DVT or PD when they are at therapeutic level. And sometimes they have the patient additional medication like aspirin, then the current DVT, OPD, stroke, and take over. And sometimes some people very high risk of bleeding, they may want to have those patients a lower INR range, maybe have to be below 1.8. Sorry, maybe 1.5 to 2.5. So for those people, they are very high risk of bleeding. Have any further question? Um, I'm going to talk a little bit about vitamin K food for people who are on warfarin as a blood thinner medication for certain medical conditions, DVTs, like different legs, or pulmonary embolism like PE, or AFib, defibrillation. So for those people who have to take warfarin, most of people who have AFib and need to take the warfarin because they have certain condition like mechanical blood fails in the body. So, how concerned about the vitamin K food uh, to warfarin and other oral anticoagulants like Alabix, uh, Geroto, or Bedaxa. So vitamin K does not affect other oral medication like Geroto, Alabix, or Bedaxa. It does affect warfarin. So when you go to Google and you type vitamin K foods and warfarin, you can find what food contain vitamin K, and some foods contain more vitamin K, some food has less vitamin K. On Google, usually they have all the common questions like people also ask when you're concerned about vitamin K and warfarin. So some questions like, can you eat foods with vitamin K and warfarin? What food should be avoided when taking warfarin? What vegetables are okay with warfarin? The vitamin K raise your iron level. So these just some most common question when people concerned about vitamin K when they are on warfarin. So in, in general, uh, in general, you should not stop vitamin K food completely when you're on warfarin. Because if you stop completely, um, it's not healthy to stop vegetables completely or stop greens completely. You should eat some vitamin K, which is, found in vegetables. So you should eat some greens, but you need to be consistent with your vegetables. You should eat same amount of vitamin K or same amount of greens every day to make sure your warfarin stable in your body. You have to eat consistent. You need to know how to measure your vitamin K. For example, uh, spinach or kale contain a lot of vitamin K. So if you eat, I would recommend that you should eat low to moderate amount of vitamin K. So if you eat half of a raw spinach for one day, the next day you should eat like 2 or 3 cups of raw cucumbers or tomatoes like that. But dark leafy vegetables or dark leafy greens contain more vitamin K, like kale, spinach, light vegetables contain less vitamin K, like cucumber or tomatoes contain less less vitamin K. So I would recommend that you should eat a low to moderate amount of vitamin K, but you must be consistent every day to make sure that your warfarin stable in stabilizing your body. Generally, when you see this question, can you eat food with vitamin K on warfarin? Yes, I would say yes. You can eat some food with vitamin K, but you must be consistent and you should know how to measure the amount of vitamin K in each food in order to make sure you eat a similar amount every day. What foods should be avoided when taking warfarin? Well, I don't think that you need to avoid any foods when you're on warfarin, especially the food affect your warfarin like greens or vegetable. But some foods, may um, affect your bleeding, like garlic or some um, other herbals. It may increase your iron, so it may increase your bleeding. So I uh, try to avoid those medication may cause bleeding. The vitamin K does not increase your iron level or does not raise your iron level. It decreases or it lower your iron level. So what it means when it's low iron level? So when your iron low, you are at increased risk of blood clot. When your iron level is high or critical, is increased risk of bleeding. That is why you have to make sure your iron are stable and in the range. Um, there are two typical range. One, the normal range for certain medical condition like EVT, AFib, the normal range between 2 and 3 for the INR. For mechanical heart failure, the INR level is between 2.5 to 3.5. So it depends on medical condition. You have a different INR range. You have any further question on this topic or the issue? Please let me know in the comment below. Thank you.
Hello, Yati. This is a good question. What is difference between both Tylenol? Um, I say Motrin is a non-inflammatory steroid um, drug. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps, like that. Whereas Tylenol is used for non-inflammation pain, like my headache or my fever or my back pain. But just pay attention on the side effect for each of these medications so you probably. So Motrin may affect your stomach, like ulceration, when you use very high dose, or you take it in empty stomach. So, and then it may affect your kidney also. So, when you take Motrin, you have to take with a full stomach, and you can take 15 or 30 minutes after eating. Um, and Tylenol is may affect your liver. So you should not exceed 4,000 milligram of Tylenol um, for any circumstance. So generally, you take 500 to 1,000 every 4 to 6 hours, but do not exceed 4,000 milligram a day. May affect your liver, especially if you have any liver disease. You should consider heavily when you take in Tylenol. And when you know, drinking too much alcohol, you should avoid taking Tylenol. May affect your liver. So those this is very important to consider when you should take Tylenol or Motrin. That's pretty much, what is different between Tylenol and Motrin. If you have any further question, please comment below. Let me know. Thank you. Hello. This is a very good question. Uh, Lots of people taking fish oil nowadays for their cholesterol um, and other medical conditions such as arthritis, inflammation, or uh, or the heart. So there are some drug interaction between fish oil and coconut. Um, some people may experience more bleeding or bruising when taking fish oil and coconut. So if you have any abnormal bleeding or bruising, um, you should report to your doctor. Anyway, before starting fish oil or any over-the-counters or herbals, you should check um, the doctor who managed your warfarin to make sure he or she aware of new medication or over-the-counters that may increase risk of bleeding when we are on certain medication, such as warfarin. And I think fish oil may not affect other oral medications such as Alaquix or Geroto. Hi, Frank. Pam, it's a good question. Basically, this is a general question I used to have. Um, Typically, it's no, we should not take Motrin while we are on warfarin because Motrin um, is a non-formulary steroid medication. It may cause bleeding when taken with anticoagulant such as warfarin or Alaquix, Geroto, any type of anticoagulant. Uh, we should not take Motrin. So if you are not allergic, um, not allergic to um, Tylenol, you should take Tylenol instead of Motrin. Hello, young thing. This is a very good question. A lot of people ask me this question when I handle manage the comedy clinic. Yes, some people have to take both warfarin and aspirin. Um, but not a lot of people. Some people have to take both warfarin and aspirin. Aspirin generally take for the platelet or certain people, certain patients have the AFib, but they don't have additional factors, so they only need take aspirin. But when they have additional factors like over over 75 or have diabetes. So generally, the JAK2 score over 2, they should take the anticoagulant instead of take only aspirin. But some people have to take aspirin and warfarin because they have additional condition. For example, people who take warfarin for the AFib and they have to take baby aspirin for the stent. People who have the stent in their body, they may have to take aspirin for 1 year also. Some people have to take the other end, anti-platelet, like Plavix. So, depend on your medical history, your doctor or your pharmacist will review whether or not you should take both aspirin or warfarin. Thank you for your question. Do you have any other further question? Please let me know. Thank you. I am think uh, this is another good question. I think uh, generally for the major procedure or surgery, I would recommend to hold aspirin for 7 days, but you need to check with the heart doctor to make sure they are okay for how to switch from warfarin to Eliquix. So you can go to Google and type in switching from warfarin to Eliquix or Abixi-ban. You can find uh, about 400,000 results. Okay, but the first few um, website help you to understanding how to switch from warfarin to Eliquix or other direct acting oral anticoagulants. So for Eliquix, we'll switch to the Eliquix when the iron are less than 2. So, excuse me. So, for example, if the patient iron is therapeutic at the Coumadin clinic visit, I used to have the patient stop taking warfarin about 2 days prior to starting the Eliquix. So, at that time I had time to send out the medication to the
patient. For example, if I overnight, then the patient should receive the medication the following day. Or if the patient pick up the medication at the window at the pharmacy, then the patient have the medication ready to switch to the Eliquid from Wolfram. So again, it depends on the iron level, so we can um, eh, have the patient switch from Wolfram to Eliquid from the outpatient setting. So if the patient inpatient or hospitalized, then it's easy to stop the warfarin and try to retest the iron to make sure it's less than 2 before start taking the Eliquid. It's more easier for the patient to switch to the Eliquid when they're still at the hospital. But if the outpatient management, then you need to like stop the warfarin for 2 days. If the iron at the therapeutic level, and then start the Eliquid to make sure the iron less than 2. If the iron a little bit high, like 3.2 or 3.3, then I would would recommend to stop the warfarin for 3 days prior to starting Eliquid. But what happens if the iron at the really high, like 3.6 or above in the time visit, then I would recommend I would reduce the dose or take a partial dose and then retest iron in 1 week to make sure iron level therapeutic before switching to the Eliquid. And when the iron at the therapeutic level, and just try to hold 1 or 2 days prior to the Eliquid, prior to starting the Eliquid to make sure the iron is. The COVID-19 caused VTE, the thromboembolism, venous thromboembolism, the DVT or PE, deep vein thrombosis or pulmonary embolism. You can go to Google, you can type COVID-19 cause VTE. It will show up, about 840,000 results. So the first few results indicate that the patient with the COVID-19 infection might experience an increased risk of venous thrombosis, the DVT or PE. So, and then you can see the most popular website in the medical field is uptodate.com. It also shows that the COVID-19 patient might experience the coagulation disorder.
website, um, BostonMedicalJournal.com, it also show that um, the patient with the COVID-19 um, are associated with the venous thrombosis. So, yes, the answer is yes, the COVID-19 may cause the venous thrombosis. So, um, I have experienced some patients who have the COVID-19 vaccine and they uh, experience the increase of the INA. So the COVID-19 vaccines may increase the INA number. It's not much. It's about between one, I mean like 0.5 to 1. For example, people who normally have INA around 2.5, they may increase the INA to 3.0 to 3.5 after vaccination. So, but it not last long. Usually they experience the INA increase in about 3 to 4 weeks. And after that, they back to the normal target, normal range. So in those 3 to 4 weeks, the patient who have increased the INA due to the COVID-19 vaccines are used to decrease the warfarin dose a little bit, like maybe just a half dose per week to make sure that I'm not outrange. It's not super therapeutic. So, excuse me. So yes, some people have a concern whether or not the COVID-19 vaccine affect the INR level or not. Yes, they, they do affect the INR level, but not much. Thank you. So how you switch from Eliquis to warfarin? You can go to Google and type in switching from Eliquis to warfarin. You buy about 300, more than 300,000 results from this search. But the top few website have some very important information for you. The first one say converting the Eliquis or Visiban. It recommend start warfarin and stop Visiban 3 days later. So this is correct, but it depends on the warfarin level. For example, the baseline for warfarin, before you start warfarin, you need to get the baseline warfarin. And the normal warfarin is usually below 0.9 or 0.9. So around that level is normal warfarin. The people never on warfarin before. But how about if
the warfarin level at that time at the baseline very high, like 0.2, I mean 1.2 or 1.3, things like that. And you may need to stop abicibin maybe days or so. And then the second option, they say maybe stop abicibin and then start the parenteral anticoagulant or the injection anticoagulant. So, like Lovenox, and then warfarin at the same time. So, for some people, they are very high risk of stroke or high risk of complicated situation. So you need to make sure that the patient not have any kind of life-threatening issue. So at that case, you may, if you want to switch to warfarin, then you probably need to make sure warfarin at a therapeutic level. In order to do that, because it takes about 3 to 5 days in order to make sure that I get to into the therapeutic level. In order to make sure that you need to have some form of injection, like local injection, to make sure the patient is not risk of having stroke or dangerous blood clot. So that's about what you need to know when you switching from aliquid to warfarin. But you need to make sure you have the baseline iron, and then based on the iron level, you may need to to make sure when it's safe to stop the aliquids. Maybe 3 days later, if you have no more baseline iron, if you have high baseline iron, then you might need to consider to stop the aliquids a little bit sooner. And then if you think that the patient is very high risk of having stroke or dangerous blood clot, then you need to make sure that you have some form of the injection, like low-venom injection, make sure the iron level at therapeutic before you stop the low-venom injection. Make sure the patient not having stroke or dangerous blood clot, like blood clot in their lungs. Thank you. All right. So, how do we switch from warfarin to Xarelto or rivaroxaban? This one is a little bit different. Uh, you can go to Google and type switching from warfarin to Xarelto or rivaroxaban. You have about more than 400,000 results. Okay? And for the first few ones, there is some information that tell you how to switch to Xarelto from warfarin. So right here they say from warfarin, stop warfarin and start Xarelto when I less than 3. You know that for the Aliquid or Bedex when are less than 2, but for Yeroto it's than 3. Why? Why is different? Because Yeroto is kind of little bit, it has a little bit longer half-life. So when it has longer half-life, means the medication lasts longer. And then it take longer time to get to the big effect. So when the iron is less than 3, so you you stop the warfarin and start Yeroto. It takes some time for Yeroto to work in your body. So that's why they want the iron less than 3 instead of less than. So, and then similar to Eliquis, if the patient had the life-threatening blood clot or having high risk of stroke, then you may need to consider the anticoagulant injection, like luminol injection. So, I mean, when you want to switch from Yeroto to warfarin, and then you might need to consider the luminol injection to make sure the patient don't have any stroke risk or any life-threatening blood clot. But when you switch from warfarin to Yeroto, then you only need to know when the iron is less than 3. Then, but it's different from the hospital libation and the outpatient patient. So for in the hospital, you may monitor iron or recheck iron maybe daily basis to make sure iron less than 3 before you start the Yeroto. But how about the outpatient setting? You don't do the iron daily basis. How do you plan for that? For me, when the iron, for example, at the therapeutic iron, then yeah, I just tell the patient to stop the warfarin, and I overnight the Yeroto, or I send the patient to the pharmacy window so they can pick up the Yeroto and start the Yeroto next day, the same schedule they are taking warfarin. So when I know the iron therapeutic, then it's between 2 and 3, then I'll say go ahead and start the warfarin for tonight and start the Yeroto tomorrow. And I know the patient will receive the medication at window, or you have the patient tomorrow via the overnight service. And how about if the iron are too low? If it's too low, then I would just say take half dose of warfarin at their schedule, and then start the Yeroto the next day at the same schedule of warfarin. What happens if the iron are too high? Like 3.5 or 3.5 or 4 or or about 3. So if it is if the iron about 3.2, then I would just say stop the warfarin for 1 day, and then, then go ahead and take Yeroto the next day. But if it's 3.5, then I might recommend to stop warfarin for 2 days prior to take Yeroto. If it's 3.6 or above, like 4, and then stop the Yeroto for 2 to 3 days. But if it's more than 4, then I will have to hold the dose and I have the patient to come back, in 1 week and to retest the iron and go from there. But I don't. If it's above 4, and I have to have the patient to recheck the iron. That's how I switch from warfarin to Yeroto. How to switch from Yeroto to warfarin? You can go to Google again and type in switching from Yeroto to warfarin. You have about 45,000 or 4,500,000 results. So that's a lot, but for the first few results, and learn how to speak to warfarin from Yeroto. So they recommend that you need to continue Yeroto warfarin. You start warfarin and continue the Yeroto together, overlap for 3 days. So you stop the Yeroto in 3 days. Switching from Yeroto to warfarin. Okay. So you start warfarin and then Yeroto, and then stop the Yeroto in 3 days. Okay. So hopefully in 3 days warfarin start working. Okay. But if the in 3 days, you test the I9 level is still too low, like 1.2, 1.3, 1.4. And I would continue Yeroto for 1 or 2 more days and increase the warfarin a little bit to make sure the patient is safe from blood clot. I should that to tell the patient to remember to stop Yeroto as instructed. Some patient they forgot to stop the Yeroto. So that's the main thing. The patient, you might call the patient. Make sure they stop the Yeroto as instructed. Otherwise, may cause bleeding. So usually for the new warfarin start, you check the iron level maybe twice a week. Monday and then the next iron Thursday or Friday. So I would recommend that you should start warfarin and then stop the Yeroto in 3 days. And then recheck the INR. If the INR is still too low, then I would recommend continue for another 1 or 2 days. Then adjust the warfarin dose to make sure not too high and not too low. And then um, recheck in about 3 days to make sure um, the patient is not at risk of blood clot or stroke. And then um, to make sure the patient is not continue taking both medication, the Yeroto and Warfarin. Okay. So if the iron is still very low and probably need to increase the warfarin to make sure it get to the therapeutic level. And have the patient to report any abnormal bruising or increased bleeding risk. Thank you. How to switch from warfarin to Badax? Go to Google and type in switching from warfarin to Badax. You have about 340,000 results. The first few top results, you may have some information. Here, pharmacist.com give you a very quick information. So you stop warfarin and start Adaxa when iron are less than 2. So this is general recommendation, but how you apply if you are from the hospital setting. If you work in the hospital, you might check iron daily. So when is iron less than 2, then you start by that on the same schedule, start the warfarin. And Badaxa is twice a day doses. You take one capsule twice a day. How about the outpatient setting? If you check the INR and INR is less than 2, and the patient has the outpatient clinic and you are able to give the patient the medication, the Badaxa, then the patient can start Badaxa at the schedule of warfarin. Stop warfarin and start Badaxa. But when I'm at the therapeutic level, like between 2 and 3, so you have to wait, like hope for 1 day to make sure I'm less than 1 to 2 days to make sure I'm less than for the patient start the Adaxa. But if the patient need to, if you need to send the medication to the patient home, if you overnight, it may take one day. And then if the INA is at the therapeutic level, then I need to go 1 or 2 days, make sure INA less than for the patient. If the INA at the time of visit is like 3 point above the level, 3.1 to 3.5, then probably the patient needs to hold more than 2 days, like maybe 3 days. And how about if the INA, above 3.6 or so, then probably the patient needs to come back to reject INA, just hold the one or a half dose or one dose to make sure that I now back to the normal range and then recheck it before further notice for further instruction. Depend on the iron level and uh, inpatient or outpatient starters to provide best recommendation when doing from different vaccine. How to switch from production to orphan or switch from a bigger trend to orphan. So go to Google and I've been switching from production to orphan. You have about 400,000 folks. Again, when you look at the first few uh, top websites, right here, stop warfarin and start a bigger trend when I'm less than lower limit of therapeutic range, less than 2. Pharmacist.com recommend stop warfarin and start a bigger trend when I'm not. So, in the hospital setting, you can do daily iron. So you check the iron, it's less than 2, then just stop, open, and start the bigger trend. But how about the outpatient setting? At the time of business, when iron less than 2, then probably you can hold the bigger trend one day and then start the Badaxa. If the patient has the medication on hand, then you may day or so to make sure that it's not less than 2, then start the Badaxa. But if it's greater than 3.6, I would hold the warfarin for one day and have the patient come back in 1 week to recheck the INI before further instruction. So it depends on the INI level in order to recommend when, how many days need to hold the warfarin in order to get the INI lesson or switching for that. I'm talking about the Alaquix versus warfarin. So why you need some people take Alaquix or Abixaban versus warfarin? So when you go to Google and you just search for it, Alaquix versus warfarin, you will have about 600,000 results. Okay, so for the first few one, you can find some quick information why they choose Aliquid versus warfarin or vice versa. So the first one from myheart.net, uh, they say Aliquid is shorter acting than warfarin. Excuse me. So Aliquid is shorter acting than warfarin, and the blood thinner effect is quicker gain or loss after about 24 hours. Aliquid rarely requires breaching because it is shorter acting and can be safely stopped a day or two before any medical procedure or surgery. Yeah, so it's Aliquid's image and the warfarin image here. It's not always the case. It is just uh, general information. I've been working for the Anticoagulants clinic for many years. So yes, Aliquid, you have to take one twice a day. Whereas the warfarin or coumadin, you take one tablet, one dose a day. So it have a longer half-life and it take a longer time to get to the peak effect and get into stable state. So usually warfarin take 3 to 5 days to start working in your body when you just start warfarin. And then it take 1 to 2 weeks to get to the peak, like the peak. And then it become a stable state after 2 weeks or so. Aliquid is just similar to the low-enough injection or enoxaparin injection. So Aliquid is the fixed dose medication. Either take 5 milligrams twice a day or 2.5 milligrams twice a day for certain patients. So it works every 12 hours medication. You should take same time every day. Every 12 hours. And then the warfarin the same time every 24 hours. Aliquid is very expensive medication compared to warfarin. Aliquid, even though you have a copay, it is very expensive, like $500 per month, and then about 1,000 or more for 90-day supply. Either warfarin is like $10 for 3 months or so, so it's very cheap. Aliquid is a new medication. I think it's available since 2018 or so, 2017 until now. It's been studied and it shows that the Aliquid is effective just like warfarin. And for elderly people, it may be convenient. They don't, have to go with the confused dosing with warfarin. Aliquid just take one tablet, fixed dose twice a day. So it may be best for a lot of patients, especially elderly people. Warfarin is very complicated in dosing. Some day you need to take one tablet, some day you need to take half tablet. It's a weekly dose, but you have to take every day. It sounds very complicated. Another advantage of Eliquis is diet. You know, Wolfen might be affected by the vitamin K foods like greens, vegetables like kale, cucumbers, spinach, broccoli, things like that might affect Wolfen. If you eat more vitamin K food, it may make the iron level go down. And if you eat less vegetable, it makes the iron level go up. So yeah, must be stable with vitamin K foods every day. Eloquence is not affected by vitamin K foods, so most of people happy with that. They don't have to watch for their diet. And another advantage of Eliquis compared to Wolfen, Eliquis doesn't require close monitoring. Okay, some people, if you are over 75 and you have normal kidney function, normal liver function, you only required to test your blood, every 6 months. And then for warfarin, yeah, you have the maximum they can extend the follow-up is 6 weeks. Okay, so 6 weeks you need to your warfarin level is not too high or not too low. When the iron are too low, it means you don't have enough warfarin in your body. When iron are too high, it means you have too much warfarin in your body. It may cause bleeding. So that's why they have to test your iron level frequently. If you are stable, your iron are very stable, then you can come back in 6 weeks. But if your iron level is not stable, you have to come back frequently, like weekly or 2 weeks or 3 weeks, depending on your iron level. If your iron level at critical, it means it's too high, like 5.0 or 6, then you might need to hold warfarin and come back in 3 days or 2 days, things like that. But Eliquis is not frequent follow-up or test. No test required to make sure the Eliquis is enough in the body. No, we don't have that test. That test is very expensive and is no required. For the side effect, somehow, and then for elderly patient, Eliquis may be better than warfarin because they don't confuse. They are not confused with the dosage. So if they take the Eliquis with the instructed dose, then they have no problem with the bleeding. But for warfarin, sometimes they confuse with the dose, and then they may take a wrong dose, and it will cause bleeding. That's one of the reasons. The second, based on the study, Eliquis may be better in terms of solvent bleeding, where to warfarin for the elderly patient. And then the Eliquis is, like I say, it's just like low enough injection. So you don't have to be breached before the surgery because you may only need to hold for 2 days prior to the major surgery or procedure. But depend on the kidney function. If you have the bad kidney function, then uh, you need to hold more than 2 days, like 3 or 4 days, depend on your kidney function, you know. And the the allergists, they only need to monitor the side effect, which is they need to bleeding. So they need to test your complete blood count to make sure the hemoglobin is not too low. If the hemoglobin too low, it means you might have some kind of internal bleeding. Then you need to pay attention on allergies, and then you need to go to see a doctor, the stomach doctor, to make sure it's not caused by the allergies. And then you need to check your right when you're on blood thinner medication. You need to check your stool and your urine frequently to make sure any kind of bleeding. Check your skin to see if any abnormal bruising. Those things that you need to pay attention, and you need to avoid any physical activity that easily cause fall. So those things need to be counseled when you're on any kind of blood thinner medication. So eloquence generally is maybe better than warfarin in terms of side effect, and then it's more convenient than warfarin because the dose is a fixed dose, and they're not required to um, test frequently, and they're not and the diet, vegetables, greens, uh, do not affect eloquence. So more convenient, and it might be better in terms of side effect for some people. The disadvantage is it's so expensive. Some insurance, some healthcare insurer, they don't pay for it. So you need to work out with your health insurance to make sure they cover. And if somebody worry about their therapeutic or their how the allergies work in their body, how do they want to know if enough allergies in the body or not. So if for some people like that, they might stick with warfarin. They don't want to try the medication. You know, if not, uh, it does not need the blood test to make sure it's not too low or too high, like warfarin. And some people need to take Eliquid with a lower dose, like 2.5 milligrams twice a day. No people because they over 80 years old, and their weight is under 132 pounds, things like that. If they have those two factors, then they require to take a lower dose. If their kidney function, if their creatinine lesser than greater than 2.5, then probably they need to take a lower dose. For certain people, like people on dialysis, they may be not the best candidate for the allergies. They should stick with warfarin. So, if you have any further question or concern about if you are taking any platinum medication, please let me know in the comment below.